So welcome everyone. Thank you for the opportunity to pitch. My name is Sydney Robinson and I'm the co-founder of Vessl Prosthetics. We created a vessel that carries amputees through their life, allowing them to be the captain of their journey. Today I'm going to be presenting a whole new way to wear a prosthetic leg. Every day, 500 Americans lose their leg below the knee, and of those people, up to 80% will die within 5 years. Most are elderly individuals and nearly all of them experience poor socket fit. You know when you buy a shoe that doesn't fit right, it chafes, making it painful to walk? Those issues are amplified in a poor fitting prosthetic socket, the adapter between the leg and the rest of the prosthesis. In fact, limb volume change of just 1 to 2% causes pain, and half of all lower limb amputees will end up abandoning their prosthesis altogether. When an amputee experiences poor socket fit, they go to the prosthetist to make adjustments. These adjustments are time consuming, and prosthetists are not reimbursed for this time. Unfortunately, 68% of all clinic visits are because of poor socket fit, leading to an almost $10 billion lost opportunity. Thankfully, Vessl has a unique solution, a whole new way to wear a prosthetic leg. It is the only socket that automatically adjusts as an amputee's leg shrinks and swells. This socket is compatible with standard connectors so that prosthetists can easily integrate the Vessl socket with any shank and foot they choose. With Vessl, amputees avoid pressure sores so they can walk around all day comfortably and participate in activities like golf. Prosthetists spend less time on socket adjustments so they can help more patients. Prosthetists are thrilled that their patients are happier and healthier with Vessl. Vessl's self-adjusting socket has a leg up on the competition. Adjustable sockets on the market rely on constant manual operation, making them inaccessible to amputees with poor dexterity or sensation loss. Our design allows for an increased degree of adjustability to accommodate a wider range of fluctuations through precise microadjustments. This makes the socket more comfortable and reduces pressure extremes that often lead to wound development. Vessl is therefore much easier to use than the status quo. The market has a couple key players and several smaller clinics. We have already begun engaging with the Veterans Affairs and will use their 2% market share to enter the industry. Then we will make a strong push to be adopted into the hanger distribution network, which represents almost a quarter of all clinics. Together, these large distribution channels will give us the foundation and resources we need to expand into the next 10 biggest clinics, followed by region-based marketing pushes to the smaller individual clinics. We anticipate being an FDA Class 1 medical device and are engaging with a regulatory consultant to confirm. The Vessl socket redistributes pressure around the leg in response to a change in limb volume to maintain a snug fit. When standing or in motion, pressure is applied to the front of the socket. As the leg shrinks, which is typical throughout the day, pressure is redistributed from the front around the leg to maintain a snug fit and automatically adjust to changes in leg size. When the amputee wishes to take the socket off, they simply release the snug fit and remove the socket. We have made significant traction in just 8 months. We have secured $5,000 from the Synapse Life Sciences competition, $25,000 from the MNSK Innovation Competition, and been accepted into 2 incubators, Velocity and BioNext, and the Western Accelerator. We are also engaged with medical device communities in the United States. 4 healthcare centers from the Veterans Affairs Innovation Network have agreed to collaborate on product validation using their prosthetic networks. We also have a dozen prosthetists and amputees under non-disclosure agreements who have shown interest in the device and provided insights on our inquiries. Currently, we are focused on protecting our intellectual property and developing our minimum viable product. As a biomedical engineer, I greatly benefit from the complementary skills of my co-founder, Alexi, who is a clinical anatomist. We both have extensive entrepreneurial training from the Medical Innovation Fellowship, which allows us to handle different aspects of the business and specialize as we expand. Alexi's background in business foundations enables him to focus on operations and finances, while my executive and technical skills enable me to forge relationships and oversee product validation and testing. We are also supported by luminary advisors. Francois is the official prosthetist for the US Paralympic track and field team and an individual clinic owner, while Molly is a clinical practice manager at a multi-center clinic. Going forward, we're looking for connections to researchers in the prosthetics and rehabilitation space to partner with us on product validation and testing. Vessl is the only company solving poor socket fit with a unique solution. Join us in helping amputees get reliably back on their feet.